And thank you very much for joining us here on PM Express. This is a conversation that Ghana has been having for the last 1 week. It is 1 week since we started our vaccination campaign, and we thought tonight we should pause and look at the progress report, because it's been a fascinating 1 week. There's a lot of lessons to learn, and just to check whether we are on track with the plan that we rolled out when it comes to the vaccination. By the way, before we start anything, have you taken your jab? If you haven't, please do. I have. I'll share my experience with you shortly when I take my seat. I'll show you a picture of myself later taking the jab and tell you what my experience has been. And those of you who have doubts about it, well, I'll tell you the numbers that I've already done it. And they are sharing very happy experiences, of course, with mild, sometimes, severe reactions to it, but all under control. But it's important to look at where we are after 1 week of vaccination for COVID-19 here in Ghana. I want to give you the global picture before we come to the local. We know that more than 319 million doses have been administered across 118 countries. And it has to be a global effort, because when you're dealing with a pandemic, the more of the world's population vaccinated, the better we all are, because it's a pandemic. People are traveling across the world. And so we need to aim at vaccinating billions of people. And so you can look at the numbers here. We are way short of where we need to be for the world to be safe again. And so this is what the picture is. And this, we'll talk about the Ghana situation shortly. Now, we are roughly 8.25 billion doses a day. That is quite impressive, right? If you compare to historical examples of similar pandemics in the world, of course, but we are still far short, as I said, of where we need to be to get a world to be safe. And so it's key to watch this. Again, look at the trends we're seeing here in terms of percentage of population given one dose, top 7 countries. And population of the country is important, because if you look at Seychelles, which is up high here, their numbers are pretty small, right, in terms of the population that we are looking at. So they've done almost 60% of the population of Seychelles have been vaccinated, which is really impressive and good, but they have a tiny population. And so you can imagine. Israel is also doing very impressive, 55% of the population. Maldives, one of the areas I want to visit, for a vacation very soon, they're doing quite well. 44% of the population has been vaccinated. UK was one of the first takers of the vaccine, and they honored it, paid it in advance. They got into a fight with the European Union about the vaccine. They stood their grounds and got their doses in on time, and they've done 33% of the population. This is a huge population of more than 80 million people in the UK. 70% of them have already been vaccinated. One dose is good. Chile is doing so. Bahrain and the US, of course, 18% there. So where is Ghana in all this, which we need to look at? Because if you understand what happened at a global level, you need to understand what is happening locally and how we are playing our part. Here, remember that we had 600,000 vaccines. The President gave us the update yesterday of 262,000 Ghanaians who have received their first dose of the vaccine as of 10:30 a.m. yesterday. We're going to get the very latest numbers as of tonight, because we have the Ghana Health Service joining us shortly. We'll update this for you on PM Express shortly. Are you part of this number? I was not part of this number. I'll be part of the number that you hear the update on shortly. And now this translates to about 0.87% of the entire population, which is pretty tiny. You saw the pictures there of the countries where vaccinations have happened. People have done 33%, 60% of the population. Ghana, we're just doing, 0.87% of the population. This is the number I wanted to focus on. So we are not doing enough in terms of the vaccination. But the key question for me tonight is, even for the number of vaccines that we have in the country, are we getting people in the right numbers showing up to take these vaccines? I mean, as quickly as we want them on a daily basis? What are the numbers on a daily basis? We need to get it to understand that very importantly. And then The target is to vaccinate, listen, 20 million Ghanaians. And here's where we are. We have a long way to go. After more than a week, if we're still doing these numbers, what does it say about our efforts? We'll put that in context for you shortly. Now, government is expecting some additional 17 million vaccines, right, to vaccinate all of us as much as possible. The Ghana Health Service is taking delivery, we know, of 50,000 additional vaccines of the AstraZeneca ones. We're also expecting some 15,000 doses of the Sputnik vaccines from Russia that is to come in also. Now, I want to quickly share something with you, because this gives us a breakdown of what else is happening when it comes to what else is happening when it comes to the vaccines, right? This is a graph I want you to pay attention to for me just for a second. A graph developed by our social media team, number of COVID-19 vaccinations by day, right? And this, watch here the number for me of, this is March 1. This is last week, Monday, when this vaccination started. On the first day, just 889 people got vaccinated. And then we picked up on the second day to, well, 14,000 people. And it shoots up on the third day to 33,000 people. Now, if you look at the fourth day, again shoots up to 41,223 people going and getting vaccinated across the country. 5th March, just before 6th March Day, Independence Day, we have our highest numbers of people showing up to get vaccinated there. This is around 44,463 people. Good. But worryingly, right after that, we dropped quite significantly below even what we had on day 3. What is happening here? I mean, we need to get that explanation. You're thinking that this graph should continuously grow and increase in size in terms of the people showing interest in this. But then we had this drop in the numbers of people showing interest on the 6th day. We are today is the 10th, and so we've done an additional 4 days. Where are we today on that? I want to get that clarity for you shortly. I also want you to see this for me, this other graph that we have here. This is COVID-19 vaccinations by sex and region, and we're getting a picture of how the regions are performing. And in terms of the sexes, which of the sexes have become more, I guess, embracing of the vaccination. If you look at Greater Accra, which I want you to focus on, we have so far 10,417 people have so far been vaccinated in Greater Accra. This is obviously subject to the update you're going to get tonight on PM Express. And if you look at it, more men than women are taking up the vaccine. What is the story in other parts of the country? If you go to the central region, same story in terms of the gender spread. We have more men taking up the vaccine than women. What does it say? I don't know. Does it mean that women are not, have concerns? I've heard some women say, pregnant women will be affected. Some even say, I haven't had children yet, and there's no much evidence to tell me how that might affect my ability to have a child, right? There are also many women who are breastfeeding who say, I don't want to take it because it might affect my child. I'm going to ask these questions so we can get some explanations about it, because it may be the reason why we are seeing this in Central Region and in Greater Accra. But that's not the story in the Ashanti region, because in the Ashanti region here, you see there are more women taking up the vaccine at a total of 55,000. And so this is a very interesting spread of the picture of what is happening so far with the vaccinations. When I return, the Ghana Health Service will join me. The public health experts, the virologists and immunologists will all join me as we begin to look back on the last 1 week. What lessons are we learning? Are we on track? But the fundamental question that I also need to ask is, are we targeting the right segment of the population by risk factors, for example, and the most vulnerable in this first phase? I mean, because I have taken the jab. I'm very grateful that I have. But I mean, I thought I didn't qualify for it at this time because, of course, underlying health conditions. So what is happening here? Let's get some explanations on this particular matter. I'm sure you also have questions. Also send me. We'll put them to the experts and get some answers for you here on PMS. But most importantly, all your concerns so far about the vaccines, we'll get them addressed also. I mean, those who are afraid, listen, many people have taken it, as you can see, and I have taken it. I'm alive, I'm fine, I'm good, I'm healthy. Take it too. But your concerns will be addressed. Stay with me after PM here after the break. Joining us here on PM Express, my guests joining me tonight from the Ghana Health Service is a senior public health officer, is Emmanuel Sali, and he's been on the ground, and I'm happy that he can join us because he has the very latest on the updating us on the vaccination program and campaign so far. And also joining me, obviously, is Dr. Michael Owusu. You know him, clinical microbiologist, researcher with the KCCL, KNUST. Dr. John Amoisi is the global public health expert, joins us also. Dr. Yabiriako, immunologist and the research fellow at the West Africa Center for Cell Biology and Pathogen, University of Ghana, also joins me. Gentlemen, thank you very much. I'm assuming that all of you, you've all taken your first jabs, correct?
Correct.
Great. Okay, you have too. You have in the studio?
Fantastic, yes, I have.
Okay, I have also. I took mine yesterday. I want to show you a picture of myself taking the jab yesterday. Don't laugh, but yeah, that's me there. And I wasn't squinting or hurting or crying. It's just the tightness of what I was wearing. So I was removing my shoulder for it to take the jab. I took the jab yesterday, as you see. This is evidence. I mean, many people said, oh, don't mind them. They're just taking water. Trust me, I didn't take water. It wasn't water therapy. I've had friends of mine say, oh, don't worry, these people, it's just water they're injecting. It wasn't water. I took the real thing yesterday. Everybody else who've done so have taken the proper vaccine, the AstraZeneca one. And I haven't reacted. I had no side effects whatsoever. This side of my arm is where I got my shot in. I haven't felt pain there. I mean, if you hit me there, of course, I will feel that's it there. If you hit me there, I'll feel a bit of the needles, lasting effect, but nothing more than that. I've eaten well, I've slept well, I have no side effects whatsoever, and I encourage you to go and get your jab also, because when you do that, you're protecting yourself, your loved ones, and everybody else. Go and get it. Nothing will happen to you. Disregard the rumors and the conspiracy theories. Subject yourself to it. The president had done so. Otumfuo, pastors, we are all alive, and you see us working and doing everything as normal. So please go and get it. And everybody else in the studio have done so also. And so I'm happy to have this conversation with you. But let me start with you from the Ghana Health Service, Emmanuel. What are the latest figures you have of people, how many people have taken up the shots so far?
Okay, so good evening, everybody. And currently, as we speak, we are talking about a total of 321,497 that have taken the shot and have synced their data into the system.
So
321,497.
Okay.
So we'll be speaking to these figures later on in the course of the discussion, because basically, as the health system, we have actually vaccinated more than these numbers.
Okay.
Except that we are using an electronic system.
So you see the numbers that he's talking about.
Yeah.
The 321,497 exactly. on your screen. But you say this is you have more numbers than this.
We have more numbers than this in reality, because people have been vaccinated at the grassroots level. We had a few issues with the data capture, and so there was some form of delay.
Okay.
Things have improved, and people are now updating the records on the online system.
Okay.
So by close of day tomorrow, in fact, as we speak, there's a live dashboard that things keep changing.
Okay.
The DH dashboard, and then all these things are coming on over time.
And one of the things I need to commend Ghana Health Service on is the electronic means of recording your data, which means that you could instantly sync everything and track. Because when I went to my center, they came to multimedia, the guy had a tablet, so it was just key in, and it's quite, so that is good. I mean, initially people had concerns because people went to the place and people had A4 sheets, and they were wondering, A4 sheets in transferring that data might be trouble, but now you have that, so that helps.
Yeah.
You're going to give me additional details?
Yes, I'm going to give you additional details. So perhaps the slide I just shared, you can just go, just to run you through by day how we have performed. So you can kindly go back to the first slide.
I mean, you just address it, speak to it.
Okay, yeah, so basically we started the vaccination on the 1st after our president of the land actually took it. And then you could see that the number of people vaccinated peaked gradually.
And your highest is 5th, yes.
The highest was on the 5th, and that's about 5,200. Now, let me just be quick to mention that this number you see, 5,200, it's even possible it can change by tomorrow.
Okay.
Because assuming somebody was vaccinated on the 5th, but then the record was not well sunk into the system, this is going to be done over time, and so that figure is likely to change. But let's see what happens on a Saturday. So on a Saturday, either people didn't move out to the centers or our teams were not too active. So you see the numbers dropped down a bit, and it's normal. It's going down until today. As at 7 p.m. before leaving the office and coming here, we had a total of 14,370 for today.
Okay.
And so these numbers are good, and we are so sure that as people walk in, this is going to improve.
I have a question for you, though, because if you look at your graph there, apart from the 5th day, which is the highest, it dropped off, picked up again on
Sunday.
Yeah, picked up again. I think this must have been 1, 2, 3, 4, 5, 6 on the 7th day.
Yep.
And then dropped.
Monday.
Okay. And then your lowest you've had so far is the very latest data you have.
Yeah.
But that must be worrying, which means that as the days have progressed, less and less people are showing up for the vaccines.
So the response to that basically is, this is as at 7 p.m. when I was leaving the office.
Okay.
People, the system we use, the DHIS tracker we are using, give people the opportunity to work offline. So by close of day, then you synchronize your data to the server. So we are so sure that a lot more work have been done, but people have not synchronized their data. So this is likely to change over time by, say, tomorrow. Our dashboard automates itself or synchronizes every 1 hour. So if it's taking like an hour before coming here, then it means that now these figures I'm even giving you have changed.
That's changed, okay.
Yes.
So we've done 321,000, which we've exhausted the first batch that came, and we've now using the additional 50,000.
Not really.
Vaccines? Okay.
Not really. So we had 600.
600, okay.
Oh, entirely as doses.
Okay.
And then this 600, if you even assume wastage factor of, let's say, maximum 10, it means that ideally, if we want to serve individuals, we can vaccinate minimum of, say, about 500,000.
Okay.
You get it?
So
for the first dose.
For the first dose, 500,000.
For the first dose.
Okay.
Assuming a wastage factor of about 10%.
Great. Okay. So what it means is that even for the 600,000,
we still have stock.
On the 10th day, you are just now hitting half of it.
By this record.
By this record,
yes,
okay.
By this record.
Okay,
but like
great.
I kept saying, we have vaccinated more than the numbers that we have.
Also, on the average, how many people are you vaccinating a day on the average? Do we know that?
On an average, based on data coming around, we are vaccinating on an average for about 45,000 across the board. Across the board.
Okay, let me bring in my experts on the telephone on Zoom now. Dr. Moisi, public health expert, so tell me this. In vaccination campaigns, if you listen to the statistics that we're hearing, that, I mean, on the 10th day, we've only done, for a country of where our target is 70 million, we've only done 321,000 of 600,000 doses that we have. Is that a good thing?
No, good evening to you, Evans, and to everyone listening. My internet is not really good today, so do confirm if you can follow me.
I can hear you loud and clear. It's very good, actually. I could see and hear you loud and clear, yes.
That sounds good. No, I just want to say good evening to you and to all those listening, my panelists, Michael and Yao, and certainly to Mr. Sally in the studio. I just really want to take the opportunity to commend the Ghana Health Service for the work done so far. Being the first out of the blocks to receive the COVAX and also to begin the vaccination almost as soon as it came into the country is by no means a mean feat, and this needs to be publicly acknowledged. I like to look at the progress in two different ways in relation to how much stock do we have, what did it take to ramp up the system to be able to distribute these vaccines, to deliver them, versus how many daily vaccinations we have done. So it means that on this 10th day, we've essentially crossed the 50% mark of the total number of vaccines that we have received, right? In any grand scheme of things, one would say that's not bad at all. In fact, if you look at the daily vaccinations in a country like the UK, which has a lot more infrastructure than we do, look at their population distribution. They're doing close to about 400,000 a day. They started off with less than 100,000 a day. And if you look at the shape of the graph of their daily vaccinations, you'd realize that the shape is not very different from ours. The truth be told, it is too early to draw any significant conclusions whatsoever on the trend of our vaccinations. We've had barely one weekend. We don't even have 2 weekends to compare. So it is actually premature to draw any conclusions on rates of vaccination per day. Until we have at least 2 weeks and more moving forward, then we can draw these conclusions. By and large, I would say having crossed the 50% mark of the stock is not a bad thing at all. Then you also need to look within, all right? Look at the rates within Accra compared to the rates within Kumasi and then the central region. As you mentioned, you can see there are some disparities there, not strange at all. You look at the male-female distribution, some disparity. It's also not strange at all, because if you look at the male-female distribution, the ratio in Ghana is about 1.036 or something like that. So if you should standardize all these, this could have easily been predicted. So the question is, are we operating below our capacity or not? And the other question is whatever we're doing, be it even at our highest capacity, adequate enough? By any standard, where we are right now, I would say is highly commendable. But we need to move further. Let's exhaust that stock of vaccine as quickly as we can, because, and I want to reemphasize, is the speed at which we carry out the vaccination is so critical to the kind of results that we get by way of the impact on reduction of rate of spread and also on the incidence of severe disease and ultimately death. Another important thing I need to point out here, and I hope that Mr. Sally will be able to address this, is the interval for between the first dose and second dose as a guarantee that we will be getting enough of the second dose. One may argue that, well, do not vaccinate until you can be sure you have enough to do a second dose. I would totally disagree with that. I would say you just do whatever you can while you can and think about tomorrow. Tomorrow take care of itself, literally. So very well, we're doing that kind of thing. But we have currently an 8-week interval between the first shot, and I've taken my shot already. I got mine last week, Tuesday, and the second one. That for me is subject to some debate at the scientific level. I will not be surprised if in Ghana we revise our schedule upwards to increase the gap to even close to 12 weeks. And I know that wasn't the subject of your question, but I'll be glad to address this issue about the time interval between first dose and second dose.
I'll ask that question.
I think it needs to be interrogated a little more.
I agree with you, because
all right.
I had the same question. I'll come to that shortly when I exhaust your other colleagues on this matter about the speed, because I took mine. They gave me a card that says I should come, I think, in April. Yeah, I mean, so, and I was thinking, okay, I mean, so I'll address, maybe people will have my same concern. But Dr. Michael Owusu, you agree with us that the speed at which you've done it now that we know what the latest figures are, is we are on course?
Good evening, Evans, and good evening to John, Yao, Pediaco, and Sally as well. Yeah, I think I do share with my colleague John on this, that 1 week may be too early for us to make any good analysis. But if you have covered about 321,000 out of 500,000 estimated doses that you expect to give in, two most populated regions, Accra and Greater Accra, in addition to Central, then of course, you know that you are making some good progress. But then there is also important to relook at the data, especially towards the latter part where this went down, and begin to understand what possible variables may be contributing to this. I think that we can't just brush over it and then maybe attribute this to random occurrence. I mean, as people vaccinate, initially, I know the excitement was up, especially when the president took the lead. And in Ashanti region, when the king took the lead, there was that kind of excitement. And many people trooped to the vaccination centers. But from what I've seen on the ground, I mean, I think about 2 or 3 days, the team moved to other sites, and other people were not well informed. So they moved to site. They are told that the site has changed and is going according to a plan. So there are still many that are hoping to get vaccinated, but they still don't have clear ideas about where to go and what not to go. So I think that it's good to pick some of this information on the ground and then inform people as well as to what to do. But I also think that as we move to the rural areas, where the challenge will be in Accra and then in Kumasi, it's pretty good. I mean, the roads well constructed, vehicles can move. You can have your cold box and then put your vaccine in. When you feel that the temperature is going down, you can refill with some ice packs or some good and keep the temperature going. But then if you have to move to the hinterlands, I mean to the upper east, upper west regions and to remote areas, that is where the challenge may likely be. And this is the time that we have to use what has happened already, pick some of the variables that could likely cause possible restraint or possible lack of enthusiasm and see how best we can address it. So for me, I think that is a good start and we are making good progress.
Okay.
But the other thing I add is that I'm happy that we have such good data and such quality data that we are beginning to understand even by levels of gender. But it will be very good that just as we have the COVID data on dashboard for the public to look at, to see, to analyze, to go along with it, that this equally has to be on the dashboard. I mean, not just in the books of the Ghana Health Service alone, but this has to be displayed such that in real time, everybody can go to the website and see how many people have been vaccinated, how many daily visits. And I believe that as people read around what is happening, they will be encouraged to go in for that.
Okay.
So it will be very perhaps subsequently, we see this along the dashboard and people.
Yeah, I mean, so I guess the line wasn't as great, but I get a point about making this accessible to everybody, putting it up in a live page that everybody can access. We'll address it shortly, but I'll bring in Dr. Yao. Doc, this is a point that Dr. Michael Owusu touched on that I wanted you to have a bite at, which is when you look at the Ghana Health Service graph we put up earlier, that showed the daily uptake of the vaccinations. You see that the very last data they have in terms of the uptake it appears to be the lowest in terms of the graph, downward slide we've had there. Does that, on the 10th day, does that give you any cause for concern that maybe as the days have gone on, you see the graph consistently after the peak of the 5th day had dipped to low levels?
Good evening, Evans, and hello to Michael and John. I think I agree with John in this case in saying that it's way too early to try to draw any conclusions from the trends. We only have, we have less than 2 weeks worth of data. You're always going to see a certain level of oscillation. But then once you have enough data and you look back, you realize that they are basically just waves, sort of minor waves in the trend. I think it's too early to know, like Sally was saying, especially the data for today is going to be probably largely due to the fact that people have not yet synced their records. And by tomorrow morning, you might see that number almost double. So I think it's too early right now to make too much of the trends. I think I agree that the fact that we've managed in 10 days to deploy more than half of the vaccines we have is a good sign. I think that what we need to now think about is where are the next vaccines arriving and when are they arriving? I mean, to me, that is the question we should be asking. We've already given out more than half of what we had. We are on course. That means that over the next 10 days, we should exhaust the current supply. We cannot stop. There cannot be a gap. We cannot suddenly say, oh, we don't have any more vaccine. Now we are waiting for more to come. So the hope is that we should be hearing of the next shipment arriving by middle of next week. If those vaccines don't arrive by the middle of next week, then I think we have a concern. So I think I think we should give credit where it's due. I think the campaign has been aggressive, and we have clearly given out half the doses. We could ask maybe a few more detailed questions about who exactly got those doses.
Yeah.
Have we really reached the saturation of the populations that are most at risk?
Yeah.
Have healthcare workers around the country had sufficient access? Of course, a lot was made about influencers and celebrities trying to drive, compliance. But, did we overdo it to the celebrities, and did we not give enough to the people who actually really do need it? So those are questions we can ask.
Yeah.
But I think in general, the fact that we've managed in 10 days to give away 300,000 is a good thing. The question I would ask, though, is when is the next shipment of 2 million or whatever it is
arriving?
We'd like to see that enter the country. Hopefully, tomorrow is Friday, so presumably Monday or Tuesday next week, those vaccines need to be in so that this campaign can continue and take advantage of the momentum that we've built so far.
Yeah, I mean, and you bring me to my next question, because it's a very important question you touched on, and then address it for me. I raised it with you earlier before I came on air, and you raised the point also. Who are those exactly getting the vaccines? Because the president told us that there was a rollout plan, and you categorized the people who are going to get in the stages into 4. The first batch was supposed to be persons most at risk and frontline staff officials, and this will include healthcare workers, frontline security personnel, persons with underlying medical conditions, persons 60 years and above, frontline members of the executive and legislature. So let's stay with it. This 600,000, presumably, you were targeting this group of people, right? I mean, are these the people actually getting the doses now?
Yes, entirely yes, because via the communication strategies that we were using as alerting people of the set campaign, we mentioned who is eligible to come for and who is not at the point in time. So if you look at our data, maybe just move to slide 8, that will tell us. So we look at our data, entirely of all these numbers that we have vaccinated, about 78,000 of them are actually the adults 60 years and above. And that is encouraging because it's a target that we actually...
Mention the number again.
So that is about 78,190 are actually those we have reached, and they fall under the adult above 60 years. Okay. The second highest category that we've been able to serve is the healthcare workers, i.e. the clinical and the non-clinical. And then you can see it's about 61,000. And it goes down to as low as the media. Okay, so security personnel, essential care workers. So entirely, we reached the people that we targeted. Okay. And so that is just how to... So
I see there on the screens that the first group of people, the most people you vaccinated fall in the 60 years and above group.
Yeah.
The second most, 60,000, is healthcare workers. Yeah. Okay. And the third most is, what is that? Protocols? You have that?
The third most is persons with known underlying
known underlying. Okay, so that's good. Yeah. And then you have the fourth being the general population. Yeah. Excluding children under 16 years.
The essential service providers, the security personnel.
Okay.
So to understand this better, because data was really a challenge trying to determine what the real denominator is. So with the estimates that we had, you can move to slide 12, and it gives you an understanding of how we have performed entirely. Okay. And so if you look at it, we targeted, for example, there are some areas that we are doing more than excess. So for example, if you pick the adult age 60 years and above, based on our target, we are doing currently, as at 7 p.m. before I came here, we're doing about 85%, of the people we targeted. Whereas if you get to, for example, another category like essential service providers, with essential service providers, we are doing a whole over 100% because at the planning stage, so you can just move to slide 12 for us and then we would understand the picture better. Yeah. So you would realize that at that stage, this category of people we targeted because the denominator...
So that's a slide there.
Exactly. So the data was not readily available to tell the exact numbers. So some are going above the targeted, so we put them in red because if you pick, let me just make a point on one of them. So executive, judiciary, and the legislature. This is another category that, based on the numbers that
108, 80, 180.
Exactly. One will be concerned. it's true, because once you are getting above 100%, it means that you are doing more than you targeted, and that is not really good. But one, we acknowledge that the denominator we use for these numbers were not truly the picture that we got, because getting this data was quite difficult.
So it's possible that you got the initial data to plan, but as you rolled out, more people that you didn't capture to plan had came on board.
Okay. And in practice or on the field, this is what happened. So, for example, under the executive, let's say any executive member comes to vaccination, they come with their spouse and a family. And so, you know, the demand generation have been so good that we say this vaccine is for these people. But because the person is coming to the system entirely with their close relatives,
you can't say go.
The system was finding it a bit tough to say that, oh, go and then come back again.
So you do everybody.
They were just
so that will be count. So if the executive, for example, if I'm a member of the executive, I come, I'm the only person. If I come with my wife and my 3 children and everybody in my household, you count them as part of it. All your data, your planning data, didn't capture it.
Exactly.
But what is impressive is that the key groups of underlying those with comorbidities and 60 years and above, those are most risky.
Healthcare workers.
You're doing close to 100% in those areas.
Exactly.
Okay. I mean, stay with me. Let me, Dr. Bediako, you asked for that data. You have it down. Your reaction?
To be honest, my reaction is a little bit mixed. I'm a little bit disappointed to see how far we've overshot our targets for certain areas. Of course, you know, it's great that we're doing reasonably well for the aged, you know, but if we're at 85% of our target, we have to be careful. It's not 85% of the elderly people in Ghana. It's 85% of the target that was set. At least that's what I'm understanding from the figure.
Yeah.
If it was 85% of the people over 60 in Ghana, then it would be fantastic. But we've only rolled this out in 2 or 3 regions. So there's no way we've hit 85% of the people over 60. So it'll be interesting to know exactly what the targets were.
Okay.
But the fact that
you have that
for the most at risk,
Dr. Bediako, just a second. You asked a question. I think you can. Do you have the what your targets were?
Exactly.
You can put. Okay, he'll put that up for you. But you go on as he pulls that data up for us.
I mean, the point I'll try to make is if we are going to overshoot our targets, we should be overshooting our targets for the most at-risk populations. So if we're going to overshoot the targets, we should have seen 120, 130% of the target among the elderly and the people with underlying conditions. Of course, it's natural that you're going to, you know, somebody shows up with their family or their sister and you vaccinate. At this time, I actually don't have a problem with that because we're trying to roll this. Ultimately, we want to vaccinate everybody who is eligible. But we should be concentrating our efforts and focusing our efforts on trying to overshoot targets in the places where people are most at risk. Let's not forget, this is a very deadly disease. The people most at risk of dying are going to be people with underlying conditions or people over the age of 60. So I feel that that graph actually looks a little bit flipped than it should be. We should be over the targets for the most at risk and close to the targets for the populations that, quite frankly, were included for reasons of sometimes, you know, the media. You overshot the target for the media. The only reason you're vaccinating the media is to try to get people to go get vaccinated. There's really no reason to overshoot your target there and not overshoot your target for elderly people or people with underlying conditions. So I think, you know, it's early days. These numbers will begin to normalize. So if, you know, we have to be careful how much stock and how much we beat up Ghana Health Service for this. But I think it should be a caution that we need to begin now with the next 300,000 doses to begin to now focus our attention. There's no need to now vaccinate media people. People already have got the message. Let's focus these doses on the people who need it the most, and let's see ourselves overshooting the elderly, people with underlying conditions, healthcare workers who are on the front line. Let's see those numbers come up so that when we look back over the 600,000 doses, we've actually concentrated in the areas that we said we were going to concentrate on at the very beginning. I
mean, Dr. Moishi, I want you to comment for me, give me a quick reaction to the graph you've seen also, yes.
No, thanks for that. I do agree to a large extent with Yao. I just want some clarification from Sally in the studio, and that would help me to put my comments in context, which is these targets which you showed, are they the targets to date or they are the target endpoints for the batch that came in? If you can answer this really fast for me, then I can make my comments.
Yes, so target, endpoint.
So it's target at the end?
Yes.
Then, well, not so bad. because if 10 days into you are at 85% of your endpoint target, well, then you're not doing too badly. Of course, I do share Yao's concern within the context of sufficient availability. And he did make that point when he mentioned the need for us to hear the news of the next batch of shipment coming in at the latest towards the end of next week. Because what would happen is if you're shooting your targets in other areas, you may have the capacity to meet your target, but you may not have enough to be able to meet it. And you don't want a situation like that. What you want to take note of, Evans, is what the Minister of Health made mention of, I think, earlier today. He suggested that we're having challenges with securing more doses of the vaccine.
True.
I don't know what exactly that means, and I don't want to read too much into it. Maybe Mr. Sally can comment on that. But it gave me a bit of cause for concern that could there be delays in getting the next round of vaccines in, and if there are delays, what does this mean? I know we've got the 50,000 doses or 15,000 of the Sputnik, and I understand that more of the Sputnik, actually large consignment, is being procured. There are several questions running through my mind regarding what happens if we don't get enough of the AstraZeneca in on time.
Especially for your second jab.
I beg your pardon?
Especially for your second jab.
Exactly. For the second jab especially, that's what I'm talking about, yes. Are we going to be doing a mixing and matching? Is there enough data to support mixing and matching? There are studies currently ongoing regarding.
I mean, explain when you say mixing and matching. Do you mean I take AstraZeneca as I did yesterday, and then 2 weeks time they give me Sputnik?
Yeah, or sometime later. Let's just stay with sometime later.
Sometime later.
Dose, yeah, because that whole question of the gap in between is a very critical question. I don't want to open that kind of worms right now. So could it be possible that you could be told that, okay, we don't have AstraZeneca, so you should take the Sputnik the next time you come around? It's certainly too early to do that here because there's not enough evidence. Of course, if you look at the science, one could suggest that it should work pretty fine. But hey, we're injecting stuff into people here, so we just can't take things on face value and say that it should be just fine. So there's several of these questions running through my mind, and I would that we sort of prep ourselves and prime ourselves up for all kinds of scenarios which could play out. I did mention the interval between vaccination as being very critical. We've been given 8 weeks. When I got my card, I counted 8 weeks. I'm sure the same for all of us. The evidence on the ground is kind of suggesting that actually 12 weeks and beyond could be even better, or is actually better. Yes. The WHO recommendations actually state a minimum of 8 weeks, the current recommendations for the AstraZeneca, which means that barring any delays, we could still buy even up to a month of time, and it would not be injurious, might actually be beneficial. So these are the things playing on my mind. And you want to think about it for the next batches. How many do you reserve for second doses versus how many do you put forward for first doses? These are all, I want to see these numbers and these calculations being put forward. But let me just say this before I conclude. I want to commend the Ghana Health Service to date for the level of transparency with the data that Sally has showed. Some of it is not so nice, and we can be critical of it. And I'm happy. This is what we want. We want to see the figures. We want to critique them. We want to offer whatever advice we can and suggestions so that we can do things better. So I think so far so good.
Great. I'll take a break, but if we can address the time gap between the first and the second, and also and I had that same concern yesterday. What if, when my time is due for the second, AstraZeneca somehow isn't available? Do you have any answers to the questions that Dr. Moisi raised?
Okay, yeah, so basically, not necessarily answers, but also to add on. So, for example, the timeline, as he indicated, is clear by WHO recommendation that the later you take it, the better, and the minimum is 8 weeks, and we can go as high as 12 weeks. Now, as a country, we have pegged ourselves with a minimum. That does not necessarily mean that's exactly the minimum. So it could be that once you are in touch with the system, and there are systems we're going to run out, such that people will be communicated to concerning when their next scheduled date is.
Because yesterday I got a sense from your boss that they are partnering the telcos.
Exactly.
And that they might be sending text messages, alerts to you to say you are due, go here for it.
Exactly,
Okay.
exactly, that's correct. So for the interval, I'm sure that government has shown so much commitment on this, and let's just be hopeful that vaccines will be available at a set period. Day in, day out, we get signals of vaccines coming in. As we speak, before I left the office, my colleague in charge of the cold chain mentioned that even tomorrow, he's picking up some stock of vaccines from the airport. Okay. So this is how serious I think as a country we are going, and let's all become and be comfortable that basically once you take your first shot, you need to relax, and when the next due date is available for you, just move it and get your second shot as expected.
I
just want to raise something
quickly. Yes.
So great comments on the
overshooting the executive, etc.
Areas, yes, but it's normal. In start, we always say that coverages can sometimes be very, very deceptive. So this media that shot up their numbers, their target for the media was 2,200 for this vaccine stock available.
Okay.
So the target is not entirely for the whole target group we are talking about, but for the vaccine stock available, this was the target that we estimated. So over 2,200 for the media, for example, we vaccinated about 2,567. That gives you about 116%. So you think that we've overshot so much. That is exactly correct. However, if you go to the main focus, so people with underlying conditions, we have vaccinated a total of 121,490.
Where your target was what?
Okay, no, we have vaccinated a total of 49,192, and then our target was 121,000.
So you've done almost half.
We've done 40% of that for people with underlying health.
So you still have, but isn't that a concern that you should be doing? You should be getting closer to
more of that. Exactly.
You should be inverting that.
Yes, exactly.
Because so, you have a 100,000 plus target. You've done 40-something thousand, so you are not even half yet.
Good. So it still goes back
out of the current stock.
The current stock. So it still goes back to the point that I raised, that for now data still gets into the system. Yeah. And so a lot more are sinking. And by the
but you said you explained this is the end point data you have.
For the targets.
Yeah, for the targets.
Okay, and not the performance. Okay. So performance, by the time I leave this particular studio, performance would have changed. Okay. Okay.
I want to take a quick break. When I return, a few quick fire questions about the vaccine that I would like to ask. I mean, how long does immunity last? And those who still have concerns about the vaccines and side effects, how are we addressing that? Stay with me. Just a few more minutes to wrap up, but a very important conversation about the vaccination campaign, the report so far. This is just the progress report. I've learned a lot that there's a lot to be happy about and commend the Ghana Health Service about, but there's a lot also to be concerned about. But there's a balancing act, and as we've learned, it's too early possibly to make a bigger point, but we are picking up where we are shortly. Dr. Michael Owusu, we have a few minutes to wrap up, but tell me this. I mean, the vaccination, key question that many people are asking is, once you're vaccinated, how long do you get immunity for? Is it forever? Well, what is this? What does the science say? Hello, Doc.
Hello, Evans.
Yeah, can you hear me? I can hear. Yes.
Yeah, this will be difficult to answer at this stage, and this is what the whole world is looking for. How long, the length of immunity? I know that a number of studies is being conducted alongside. So in many countries, for instance, it's not just about mass vaccination, but what they are doing is that they are collecting serial blood samples at some 1 month, 2 months, 3 months. They hope to go 6 months, 1 year, even 2-year archive sample to look serially how much antibody response you built, the threshold of these antibodies, and to even monitor those who are vaccinated to find out whether they will have reinfections, and then compare that to the level of immunity they have at different time points. And they are doing this for AstraZeneca, doing this for the Russians, Sputnik V, Johnson & Johnson. So there are a lot of power research ongoing, and until we are able to go through that, it will be extremely difficult for anybody to tell how long this will be. So, I mean, I know maybe if those studying immunology would tell you that it's difficult to really tell how the responses go, how long this will stay, whether at a threshold this will remain for prolonged periods of time or not. So
Hold on for me on that. And let me bring Dr. Bediako because he's an immunologist here. Let's see if he has something else to add to that. Dr. Bediako, any thoughts to share on that? I've been asking that question. I mean, when I get a jab, how long am I safe for?
So first of all, it's important to remember that after you get the jab, you're not protected for a while. So for people who've got the first dose, it takes 21 days, 14 to 21 days for your antibody levels to begin to rise. So, just because you, Evans, you got the jab just yesterday, you're not protected yet. So that's something to remember. And these are designed to be true dose regimens. So really, we're only going to achieve the maximum level of protection this vaccine can offer after we get our second dose. In terms of how long protection, so this is now talking about protection after we've got both doses.
Yeah.
We are still trying to follow up. These vaccines have not been in existence for very long. People who were vaccinated, it's not been a year since somebody was vaccinated, for instance. So we are looking at, there's data suggesting that at least for 6 months there is protection. I believe some manufacturers, I think Moderna or Pfizer, have modeled out that their vaccine, at least for a year, might offer protection. So we're looking at, it's a finite window. It's not going to be for life. It's not going to be indefinite. It remains to be seen exactly what the timeline is.
Okay, Dr. Bediako, unfortunately, because of time, but I need to give you 30 seconds to address. Are you publishing this somewhere? 30 seconds, strictly.
Okay, that's fine. Yes, so we are publishing this on the Ghana Health Service website. My program manager have mentioned, and the team is ready to share that. So just at a click, you can all have access to the data by day as we move on. Just moving on, I just want to also mention that this phase 1 have really given us the opportunity to learn a lot. And so we are just saying that for all other districts and regions concerned as a country, you should all start working on your micro plans so that you can do better when it gets to the campaign. Kudos to all leaders.
And you guys have done a good job. We'll learn a lot so far. Gentlemen, thank you very much. Enjoy the rest of your evening.